Hello and welcome. This is Hands on Health, a podcast all about living your healthiest life on the coast. I'm Austin Miller.
And I'm Alyssa Evans. Today we're talking to CMH's Patient Experience team. We have Mariana Kirkendall, who is the Experience Representative, and Kristen Moss, who is CMH's Patient Experience Manager today. Thanks for joining us.
Thanks for having us.
To get started, Mariana and Kristen, would you mind describing what your jobs are to people?
Yeah, we work at CMH to make it a good experience. We want to ensure that all patients have a good experience receiving care in the hospital, that visitors have a good experience when they're coming to visit, and that employees have a good experience when they're working here at CMH. So that's really what our department works on, is making sure everyone that interacts with CMH has a good experience.
And Mariana, what is it that you do?
I work with inpatients in med-surg and the critical care unit. I visit with them and I ask them a few questions about their experience and mostly give them information regarding all of our programs and things that we offer, access to their health information, just really try to make them have a better experience. And nobody feels good when they're in the hospital. So just trying to make them feel more comfortable, make them feel, cared for, and have them just be there to listen to them if they need it.
What led you guys to want to work in patient experience?
I have always wanted to work in a hospital, and I thought maybe becoming a nurse would be something I would like to do. When I started my position as an experience rep, I realized that I get more one-on-one time with the patient than the nurses do. The nurses are fantastic. They are great, and they are really caring, but I really wanted to just mostly interact with patients more, have a relationship and build that relationship with them. And that's what I'm able to do. I can spend hours with a patient if I wanted to and if they wanted me to. So it's really nice. I get to meet all kinds of people and meet new friends. So I've enjoyed that.
For me, I'm passionate about making things better, making people better, making experiences better, making the world a better place. And I've really found that in the patient experience department and working with patient experience, because the work we do makes things better. We're changing healthcare, working on changing the way that people interact in a healthcare setting and really making it about people and not just about clinical things and diagnoses. It's all about making things better. And I love working in a hospital and in the capacity to make change in healthcare.
So I know that your department has a variety of employees who work in it. Do you mind explaining what type of roles some of the other team members do?
Our department covers a range of different services within the hospital. The first people that you'll meet when you come into the lobby is our hospital concierge. And these people are there to make sure that your very first experience when you walk into the hospital is a good one. They'll help you to find where your appointment is and make sure that you get pointed in the right direction. And they help people who are in crisis and really need help finding the emergency room or just need a friendly face when they first walk into the hospital. We also have chaplaincy and spiritual care within our department. Our chaplain, Lori, is fantastic with patients and really helps people to have a good spiritual experience while they are at any point in the hospital or in the healthcare system. We also have an experience coordinator that helps with employee experience and collecting data to make sure that we are on track with person-centered care and experience within the hospital. The gift shop also falls within our department, and we have another Lori who runs the gift shop and our volunteer services. These kinds of things help being in the hospital to not feel so daunting and scary, and making sure that people have light and uplifting experiences within the organization.
Wow, that's quite a list of things that you guys do. You guys cover a lot of things I think most patients probably don't realize is considered so in depth as you guys think about things. So what types of patients does your team interact with typically?
I specifically work with inpatients, and I try to make their experience better. We offer entertainment such as coloring books, watercoloring, and puzzles, just things to do, or even play cards or games with family. We also want to make sure that their family members are cared for and they're welcomed, as well as their pets.
Mariana's really, really good with the patient. She's very detail-oriented, and we're so lucky here in Clatsop County to have somebody who works with inpatients so closely. She does a really good job of celebrating patients' birthdays or anniversaries if they happen to be here in the hospital on those special occasions. Mariana's done things like run to McDonald's for a patient when nothing in the cafeteria sounded good, or she's searched high and low all over the bookstores within the community to find a certain book for a patient. Just things like that, making sure that the experience here is personalized for every patient. Outside of the inpatient unit, which Mariana works with, we work with the patients from all over the hospital. It could be just an interaction, a hello. It could be collecting data on their experience and analyzing it to make sure that the experience for the next patient is even better and more robust. So we really touch patients from all aspects of the healthcare system.
I think that's amazing. And I think that it's really neat to see all the different interactions that happen. I know those are just a handful of them, but I think that's really inspiring to hear. Are there any challenges that your team has experienced recently?
It's been really challenging to make healthcare a good experience in the middle of a pandemic. Our department also works with employee experience, and it's been really hard to keep the morale for any employees throughout our culture, but especially in healthcare. So really striving to keep up our person-centered certification and the different initiatives that we do throughout a pandemic has been really challenging.
On the flip side of that, what are some of the successes that you've seen?
Our department has really tried to start implementing those programs that we had before COVID, like the visitors, allowing, more visitors for patients and their families to enjoy each other's company and for their comfort as well. Like I said earlier, pets are also welcomed. And I know patients really enjoy that. Their pets are like family to them, and implementing aromatherapy and all of these things. We have been working really hard with the nurses and other staff members to make it a better experience for our patients.
We also work on employee experience, and a really big initiative for us over the last probably year and a half has been to implement diversity, equity, and inclusion practices within the organization and provide training to all of our staff on diversity. This has been a challenge during the pandemic to get training out to all of our staff, but we've been able to work on that. And we held a diversity, equity, and inclusion task force with 26 members of our CMH team. And we've been able to implement little changes to make sure that CMH is a really great place that everyone feels included. Another success that we've been working on right now is our Plaintree recertification. We have to recertify every 3 years, and 2022 is a recertification year. So this has been a big task for our department, making sure that we have all of those person-centered care elements in place so that we can maintain that certification. And a lot of that work has been rebuilding our programs after the pandemic. And I feel like we've been really successful at this.
Follow-up question for you, Kristen. I know in our culture at CMH, we eat, sleep, breathe Plaintree, but for those who may not be familiar with that, what is Plaintree?
Yeah, great question. Plaintree is it's an organization that embodies the values of person-centered care. And we have affiliated with this organization since 2008. And we're just striving to incorporate those elements that Plaintree values. Things like goal setting with patients and partnership and making decisions based on data and asking people what they think. For example, we got new inpatient beds a few years ago, and we asked patients, which bed do you like and what do you look for in a bed? So just really partnering with our community, partnering with our patients, and making sure that it's a good experience here at CMH. That's the values of Plaintree. And those are the things that Plaintree embodies that we're trying to incorporate here in Clatsop County.
Because you guys work so closely with both patients and with caregivers, are there any experiences that really have stood out over your guys' tenure working here?
Yes. So we have one of our CNAs who has worked here a very long time. She's great to work with, and she's very loving and very compassionate about what she does. She has been going out to our garden and cutting all these beautiful flowers and making them into gorgeous bouquets and delivering them to the patients and putting them in their rooms so that they would be able to enjoy them.
One really neat experience during the pandemic was we had a patient that was getting ready to pass away and was just not feeling good and didn't have family support like we would have expected and hoped to see. Mariana and our chaplain, Lori, visited with this patient to really understand how they could help this patient have a good experience. Well, they found out that the patient has a pet chicken that they just absolutely love. And Mariana and Lori coordinated with the patient's family. And during a pandemic, we had a chicken come and visit a patient. The family brought the chicken in a carrier and brought it in to see the patient. And they got the chicken out, and there was a chicken on an inpatient bed. And the patient ended up passing away not too long later. It's these kind of experiences within our healthcare system that increase the level of compassion. It's not just about a person's diagnosis or even getting better. It's about treating people like they matter and that their healthcare and that their experiences in healthcare matter.
Wow.
Yeah, I think that's great. Well, thank you both for joining us today. It's been great hearing from both of you. And thank you for also joining us. This has been an episode of Hands on Health, brought to you by Columbia Memorial Hospital in Astoria, Oregon. CMH is an independent, not-for-profit health system that provides comprehensive, person-centered care in Northwest Oregon.
Find us wherever you listen to podcasts, online at columbiamemorial.org, and on Facebook, Instagram, Twitter, and LinkedIn. Thanks again for listening. We hope you'll join us next time for another episode of Hands on Health.